Kwekwe ulukut, tanse, hello, bonjour. I first want to acknowledge my presence that I'm speaking to you from the traditional territory of the Algonquin and Anishinaabe people. I am joined here today by Chief Medical Officer at Indigenous Services Canada, Tom Wong, and Associate Deputy Minister Valerie Gideon. Tom will be offering some words after me today. Let me begin with an update on our fight against the pandemic in the Indigenous communities in Canada. As of February 3rd, in First Nations communities on reserve, as well as Northern and Inuit regions, we're aware of 1,885 active cases, which brings us to a total of 17,758 confirmed positive COVID-19 cases and tragically 174 deaths. Nous commençons par contre à voir les résultats des mesures de santé publique plus fortes mises en place par les communautés, provinces et les territoires depuis décembre. Nous constatons également une réduction de la transmission dans les communautés des Premières Nations et dans le Nord. Mais que cela soit encourageant, la stabilisation ne signifie pas pour autant la fin de la pandémie. Il reste un certain nombre de facteurs inconnus dans la lutte contre ce virus dévastateur. Et ce n'est certainement pas le moment de réduire nos efforts. Nous devons travailler ensemble pour maintenir ces mesures en place. I'm going to provide an update on the vaccine rollout, but before that, I'd like to step back and talk about an issue that profoundly affects Indigenous people's health in this country. Last week, we brought together all levels of government, healthcare professionals, and Indigenous partners to discuss anti-Indigenous racism in the healthcare system. This was, in fact, the second national dialogue on this matter, and it focused on concrete steps that Indigenous and non-Indigenous organizations involved in key parts of the Canadian healthcare systems are prepared to take to eliminate anti-Indigenous racism. Provincial and territorial governments were also invited to outline the work they have underway in their jurisdictions and the work they commit to undertaking in the future. There's a shared commitment to build on the current momentum to make real and lasting change, but one thing is clear, very clear, a significant amount of work remains to be done. Tous les Autochtones doivent recevoir des services de santé de qualité sûrs et exemples de toute forme de racisme et de discrimination. L'histoire de Joyce Echaquan n'était pas un incident isolé. C'était la manifestation de problèmes qui se produisent trop souvent dans notre système de santé. Il a fallu les médias sociaux pour porter à nouveau l'attention de tous les Canadiens. Le décès tragique de Joyce nous conduit à honorer son héritage à travers le principe de Joyce. C'est un pas en avant important et comme l'ont partagé le Conseil Atikamekw de Manoine et le Conseil de la Nation Atikamekw, le principe de Joyce identifie les mesures nécessaires à tous les niveaux du système de santé, y compris par les gouvernements fédéraux et provinciaux et territoriaux pour lutter contre le racisme anti-autochtone dans les soins de santé. Reconnaissant leur leadership, le gouvernement du Canada versera 2 millions de dollars à la nation Atikamekw et à la Première Nation de Manoine pour faire avancer leur plaidoyer en faveur de la mise en œuvre du principe de Joyce. The federal government is resolute in eliminating anti-Indigenous racism in the healthcare system. To achieve this, we've launched the process to co-develop Indigenous health legislation. The legislation will aim to ensure Indigenous control over the development and delivery of their health services. To support this initiative, the Fall Economic Statement proposed an investment of $15.6 million over 2 fiscal years to support the co-development of distinctions-based health legislation with First Nations, Inuit, and Métis Nation partners. As part of this effort, we will work collaboratively with Indigenous partners to develop and share tools and resources to increase knowledge of Indigenous practices and ways of being. This also means greater representation of Indigenous peoples in the healthcare field, anti-racism training for healthcare physicians, and improvements to ensure culturally competent care. We can no longer remain idle in front of this flagrant infringement of human rights and on basic Canadian values. We've already seen instances in the media of racism related to the vaccine rollout, where some individuals have questioned why Indigenous peoples are prioritized. As I've spoken to this before, the decision to prioritize Indigenous people living in remote communities, but also in other parts of the country, including those living in urban settings, is based on science. It's not a matter of politics or opinion. Thankfully, we're seeing increasing support of Indigenous communities to deploy the vaccine as soon as it is possible. As of February 3rd, 320 First Nations and Inuit communities with vaccinations underway in the provinces and territories, and 64,351 doses have been administered to date. In the coming weeks, we expect to see 75 more clinics in communities across Canada. Delivering and administering vaccines to communities has called for extraordinary efforts. For example, think of the dedication of people like Willard Pedagumskung, a Cree airplane pilot. He fought a snowstorm to deliver vaccines in a few First Nations communities in northern Quebec earlier last month. In Nunavut, vaccinations are well underway. The territorial health authorities have now received 12,000 of the 37,500 allocated doses of the Moderna vaccine. Vaccination clinics were held in Iqaluit, Rankin Inlet, Whale Cove, Arviat, Baker Lake, Greasy Fjord, Johaven, Igloolik, Chesterfield Inlet, and other locations. This is an extraordinary mobilization with huge logistical challenges in northern and remote communities. So far in Saskatchewan, over 3,700 doses have been administered in First Nation communities, which represent 10% of the provincial supply. In Manitoba, all 63 First Nations communities have started receiving vaccines for priority groups. This is so important, knowing the stronger impacts of COVID-19 on First Nations across the province, whether living on reserve or in urban centres. I want to applaud foremost Indigenous leadership, many of whom are contributing to the vaccine efforts and have posted on social media about being vaccinated in order to reduce vaccine hesitancy, like Chief Munias in Neskantaga First Nation. And as we saw in Neskantaga across Northern Ontario, the Orange Team is conducting Operation Remote Immunity. They're coordinating the vaccination of members in Anishinaabe Nation that are spread out among 31 First Nations, working with the support of the Canadian Armed Forces. Vaccination started this week in 6 remote communities under this campaign, and many more in the weeks ahead. Au Labrador, le gouvernement Inuit de Nunatiavut nous informe que 71% de sa population adulte a maintenant reçu la première dose du vaccin Moderna. Dans les zones urbaines comme Montréal, des cliniques de vaccination sont en place pour la population autochtone sans abri, notamment une tente chauffée installée en l'honneur de Raphaël André. And the Canadian Armed Forces are also providing life-saving assistance to the people of Fort Nelson First Nation in British Columbia and to Ganuming First Nation in Ontario in response to a growing number of COVID-19 cases in these communities. I was pleased to hear that the BC government responded swiftly to the redirection of vaccines from the First Nation community of Nuxalp by making sure they received doses they were promised. We're still on track to meet our end of March objective of having administered both doses of the vaccine to 75% of people in regions that are considered at higher risk. And on that note, Canada will receive an additional 180,000 doses of the Moderna vaccine this week, in fact, today. I salute the creative solutions that are put in place throughout Canada in the face of this huge challenge. For instance, we're seeing innovative management of caseloads that includes moving consultations online, the use of RVs to deliver services to vulnerable city populations, and mobile vaccination teams traveling to rural communities to administer the vaccines. Je tiens également à remercier les professionnels de la santé, qu'il s'agisse des infirmières, des médecins, du personnel paramédical, des chercheurs, du personnel d'entretien ou des administrateurs qui ont fait preuve d'un dévouement remarquable. Après plus de 9 mois de pandémie, ils continuent à faire preuve de force et de résilience. Throughout this pandemic, people have been pushed past their limits, and I salute Indigenous communities that have been especially resilient throughout the crisis and continue to be so. We can't let up in the fight against COVID-19. We must act decisively, and we must continue to act with the same sense of urgency that has characterized our work up to now. Miigwech, Nakumik, Marcy Cho, thank you et merci. Tom.
Although we are beginning to see the results with reduction of active cases by over 50% since last week, right now, less than 2,000 active First Nations on reserve cases have been reported for the first time since early December. We must remain vigilant and continue with community-specific public health measures, such as physical distancing, such as hand sanitizing, avoiding gatherings, wearing a mask, and staying home if we are sick. As vaccine rollout continues, it remains critical that First Nations, Inuit, and Métis leaders and partners across all settings are included at decision-making tables and continue to be engaged in co-planning to determine ongoing capacity and needs within respective communities. It is essential that Indigenous population remains a priority as provinces and territories begin planning for the next phase of the vaccine rollout. A COVID vaccine plan developed by Indigenous Services Canada, First Nations, Inuit, Métis, and provinces and territories is now available that highlights the roles and responsibilities regarding COVID vaccine planning, distribution, administration, reporting, and communications. La collaboration avec des provinces et des territoires est nécessaire pour planifier en collaboration avec les partenaires autochtones afin de donner la priorité aux communautés et aux milieux autochtones à risque élevé, y compris les quartiers urbains pauvres, ainsi que poursuivre conjointement l'utilisation des vaccins et les effets secondaires. Continued collaboration from provinces and territories is needed to co-plan with Indigenous partners to prioritize high-risk Indigenous communities and settings, including impoverished urban areas, as well as co-tracking vaccine uptake and adverse events. We need to be kind to one another as we navigate these difficult times. Miigwech, Nakumik, merci, Marcy, thank you.
Merci. Nous allons maintenant répondre aux questions des journalistes, une question de suivi, and we'll start with questions over the phone. Operator, over to you.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question, la première question, is from Dylan Robertson, Winnipeg Free Press. Please go ahead. Your line is open. Votre ligne est ouverte.
Good morning, Minister. The Manitoba First Nations pandemic team keeps asking people to stop gathering. They've warned that funerals keep becoming super spreader events, and I'm just wondering if your department is doing anything to tamp down on these gatherings, like producing messaging or something more aggressive, like asking the chiefs to crack down on this.
I think it's an excellent question, Dylan. In fact, that is the case. Funerals, weddings, and as you can imagine, highly emotional events where people do let down their guard are a source of super spreading, and there's no denying that. We've seen gatherings from early on in the second wave that in urban communities that spread. One particular instance spread to 14 communities. So it is a real threat. It continues to be a real threat. We've been working on this from the very beginning to ensure that chiefs, health leadership in communities have all the information they need to ensure that these events, if they choose to have them take place, are ones where they can respect the social distancing protocols and the gathering limits. It is always a very, very direct conversation with healthcare teams on reserve and leadership, but we stand ready to help them. We've been producing messaging, I think, from the very beginning. Dr. Gideon can speak to that, as well as Dr. Wong, in and around these events, including funerals. And I really, the pandemic response team in Manitoba has been doing an exceptional job in being part and parcel of getting that information out there and getting the warnings out there to ensure that those gatherings don't take place. Any of these events are a cause of great concern, and it is a question of continuing our dialogue with communities to make sure they have all the information, all the resources necessary to make the important decision when they choose to have a funeral, that it respects all the guidelines so that it doesn't become a further source of tragedy. Dr. Gideon.
Thank you, Dylan. I'll just add that I think the chiefs have been extremely proactive in seeking support when they do require surge security services, whether that's from the RCMP or other security capacity. I mean, it has been a priority for them. And we can see that with the reduction in the numbers of active cases in Manitoba, which has been pretty dramatic over the last 2 weeks, that certainly what communities are doing is working. And it is really a question of continuing to support them so that they can sustain those efforts, because because absolutely people are tired. And I think we have to recognize not just the social challenges, but also the mental health challenges that result from prolonged periods of social isolation. But I would say that, the Assembly of Manitoba Chiefs, for example, organized a Facebook Live event recently. They invited the minister to participate, Grand Chief Dumas, and they have had their Indigenous health professionals, such as Dr. Marcia Anderson and Dr. Barry LaValle, very proactively speak to communities to inform them about the risks of gatherings, but also any other practices that could lead to greater community transmission.
Dylan, do you have a follow-up?
Yeah, thank you. This one's for the minister as well as Ms. Gideon. Dr. Cindy Blackstock has produced an email exchange with your department in which your department is suggesting First Nations who assert child welfare jurisdiction under C-92 will lose out on the tribunal funding benefits. The quote is, "Since the Act falls outside of the scope of the CHRT orders, the CHRT orders will not apply to a First Nation that has assumed jurisdiction." I'm wondering from the minister if that's fair or acceptable to you that First Nations would lose out on this funding for starting their jurisdiction, and from Ms. Gideon if that's still the department's perspective on this.
Well, I hope to give you a brief answer on this one, Dylan. I think what people need to retain is that the CHRT orders, and particularly Jordan's principle, as it evolves, are very much a baseline in these discussions. The CHRT orders, as you well know, have been framed around fixing a problem that shouldn't have occurred in the first place. And C-92 is very much part and parcel of moving forward in how we fix a broken system, how we lift up Indigenous jurisdictions over what they hold dearest, which is their children and the family services, which the federal government and provincial governments and territorial governments have failed them historically. That was the basis on which C-92 was grounded. And so I haven't seen the quote, or I haven't read it entirely yet, Dylan. So you'd have to afford me that opportunity to look through the detailed back and forth of what that communication is. But I think, given the sophistication of the parties involved, everyone knows that Jordan's principle and the CHRT orders in particular are very much a baseline to the discussions that we have with communities that are then lifting up their jurisdiction and moving away from a broken intervention system to very much a prevention-oriented system. And so the coordination agreements are intended to perfect that crystallization of jurisdiction. They are obviously difficult discussions, but those nations that are at the table know what they want for their children, and they know precisely how the federal government and provincial government have failed in the past. So yes, financial backing, financial supports will be part and parcel of those discussions. So I would think that the way you framed that quote, Dylan, looks to me like a bit of a square reading of what C-92 is intended to do, and everyone knows that it is intended to fix a system that is broken by lifting up the jurisdiction of First Nations over their children and the family services that serve them, so that we can truly achieve substantive equality that has up to now not been the case. So again, that's my summary answer to some exchange that I actually physically haven't read. Valerie.
I think the minister responded very well. I would just say that the current process is for agencies to submit claims to the federal government for often reimbursement of expenses that they've incurred. And so the federal government is in a decision-making role with respect to these claims. I think under the new legislation, First Nations are interested in looking at having greater control with respect to child and family services, where the federal government is not in a day-to-day decision-making role with respect to the reimbursement of claims for expenses that they've already incurred. The objective is to have long-term, sustainable, comprehensive funding that will support their decision-making, as the minister has indicated, and their self-determination with respect to the future of the children in their nations.
Thanks, Dylan. Operator, next question, please.
Thank you. Merci. Please press star one on your device's keypad for any questions. The next question is from Zach Becerra from Saskatchewan Starfian. Please go ahead. Your line is open.
Hi, Minister Miller. Earlier this week, Saskatchewan ended a long-standing practice of issuing birth alerts. Many Indigenous organizations and First Nations were very happy about this news. The question for many of them is what kind of supports come to sort of create a better way, as it were, of protecting vulnerable children and making sure that families, whenever possible, can stay united. I want to ask, what is your ministry's role in those discussions right now? And can I get your response in general to Saskatchewan ending this practice?
It's very good, long overdue news. I think that these practices have been demonstrated to be discriminatory, racist in many circumstances towards Indigenous peoples, and were part and parcel of ripping Indigenous children away from their families. And they are very much part of the discussions that we've held over the last few weeks over reforming the healthcare system to be more fair towards a group of people in Canada, Indigenous peoples, that have been treated like second or third class citizens. To the specific issue of reforming and protecting vulnerable people, I think this is part of the discussions that the prior Dylan asked earlier with how you move forward in ensuring that people are properly accompanied, and when they are at their most vulnerable, and giving birth, certainly perhaps one of the most vulnerable situations you can find yourself in, that they are properly accompanied and have all the resources necessary to accompany young families, and that this has been and these are painful iterations of a greater problem, which is how Indigenous peoples have been treated by the Child and Family Services, by the healthcare system. There's a nexus there that shouldn't escape anyone, and it is very much a set of reforms that we have put into place and are continuing to put into place, but are by no means easy or instantaneous to fix. I note as well the determination in BC that these birth alerts were deemed to be illegal, which is also a good development. This is a process that is happening slowly, perhaps not fast enough for some around the country, but it is welcome, and it falls squarely in my mandate to accompany. And there's some jurisdictional issues here for sure, but what we know with jurisdiction in all our interactions with Indigenous peoples is too often it's on the backs of Indigenous peoples that we fight with each other. So my offer to provinces and territories is to work with them together to serve peoples who have been underserved, particularly when they are at their most vulnerable. I don't know if Valerie.
Just to applaud, the long time advocacy of First Nations in Saskatchewan and across the country with respect to these practices, but also overall their vision for, their jurisdictional aspirations with respect to Child and Family Services. And I know that we have been working very closely with the Federation of Sovereign Indigenous Nations and other representatives in Saskatchewan First Nations to really look at the future of Child and Family Services and how they can support nations in moving forward. So it is great news when you see provincial government really wanting to make changes also within the provincial system so that hopefully the visions can come together and really support nations in their plans.
Thanks, Zach. Do you have a follow-up? And then we'll go to questions in the room after.
I do have a follow-up. Thank you very much. In regards to Minister Miller, you spoke a little bit there about the need to prioritize urban Indigenous populations as well as First Nations living on reserve in the vaccine rollout. Saskatchewan, in its first phase of its vaccine rollout, actually did not specifically mention or refer to Indigenous peoples. I haven't heard of any province explicitly outlining urban Indigenous populations as a priority yet, whether it's in phase 2, phase 1, phase 2, or phase 1.2, whatever you would have it. What tools ultimately do you have to encourage provinces to consider urban Indigenous peoples as a priority group? What are your options?
BC and Ontario have explicitly referred to and acknowledged the vulnerabilities of Indigenous populations in urban settings. We know that this is, I'd have to check that for you, but we know that this is a challenge. We've seen a particular instances of that, particularly with hospitalizations and ICU numbers disproportionately affecting Indigenous populations in the second wave of COVID as it hit quite hard in Manitoba. I would acknowledge as well that the data is spotty, but we know and we know that when we talk about social determinants of health, the adverse outcomes, comorbidities that exist with respect to COVID, they are more prevalent within Indigenous peoples, and that fact and that scientific reality does not end at the reserve sort of line where it exists in urban communities. It exists throughout the far north. I think it's important for Canadians to understand that when we talk about phase one, we're talking about our best sense of how to deploy limited amounts of vaccines to those that are the most vulnerable. So on the margins, you will see imperfect results. And I think as you see limited numbers of vaccines being distributed over the next few weeks, those fault lines will perhaps even be greater. It doesn't change the reality that in Indigenous settings and in urban settings, Indigenous peoples are extremely vulnerable, particularly those that happen through no fault of their own to be homeless. And we've seen cities, particularly in Toronto, but also Montreal, mobilize to reflect that reality. It's still a discussion that is ongoing with provinces. It requires, the federal government has limited effective jurisdiction in healthcare in urban centers. Everyone knows that. But it doesn't change our commitment to advocate and to work with provinces to vaccinate those that are the most vulnerable, because they are not the most vulnerable, and not because I think it's politically expedient or a matter of opinion. It is a fact. And so that is the work that we continue to do, namely at trilateral tables and various subgroups that focus specifically on Indigenous peoples, and we'll continue advocating for that, for those particular communities.
In addition to, at the national level, we have established in FPT Indigenous working groups specifically for urban Indigenous vaccine planning. One of the things that, we are encouraged to see is that in BC, recently, BC had mobilized its vaccines in order to reach out to downtown East Side, the homeless population there, as well as in Montreal. And in Ontario has established a working group specifically for urban Indigenous peoples. As well, in Manitoba, there's active discussion between the province, us, as well as Indigenous peoples in order to try to see how to roll out vaccines in urban centers in Manitoba. And we need the help of all provinces and territories in order to help support Indigenous peoples who are underserved in those settings. Thank you.
Thanks, Dr. Wong. Thank you, Zach. Olivia, would you like to go ahead?
Thank you. Good morning, Olivia Stefanovich, CBC News. We're hearing that there is going to be more disruptions with the Moderna vaccine shipments, and I'm wondering if you can tell us whether this will impact the rollout with the COVID-19 vaccine in Indigenous communities and if it will push back the rollout.
I think, Olivia, it is in fact too early to speculate. I think, as generally with respect to the vaccine rollout and a global undersupply, this is something that it's a bump in a road short term, if that is the case, and it will affect a number of the elements that we have in terms of our planning, usually in the short term. But I would say that so far, with respect to what's been rolled out, it's been rolled out in an exceptionally short period of time under the leadership of Indigenous peoples that have done an amazing work. And as I noted in my introduction, 320 communities representing about 65,000 doses have so far been distributed. So that's great news. Obviously, any disruption at all is a matter of concern. We want those vaccines in as quickly as possible. It's why we have that suite of options with respect to a number of vaccine portfolios. But it's hard to speculate on the ground how that will fold out over the next few weeks or months. This is a long-term plan of getting by September, and with respect to Indigenous peoples, even sooner, that last vaccine into that last arm. And so I think periodic disruptions in the face of a global undersupply are unfortunate, and they are situations that we have to compose with. And it is why we've been continuing to take extreme precautions, lockdowns in certain provinces, ensuring in the work that the two people beside me do on a daily basis, probably one closer, you wouldn't want to know their work hours, but ensuring communities are safe. I mean, you could vaccinate everyone in Canada tomorrow, and people would still contract COVID for the next 14 days and perhaps even beyond. We want to, I'm not being flip about that, but we are moving as quickly as we can to ensure that we do everything under the sun to get vaccines into arms and to keep people safe for a longer period of time, and that has repercussions in communities. And so far, I would highlight the amazing work that leadership has done in doing so. But I can't speculate as to what further shipments will look like and how it gets deployed on the ground.
Besides concerns about vaccine shipments, I'm wondering if each of you might be able to tell us what you think the biggest challenge is to vaccinating Indigenous people in Canada. And also, is there an estimate when you think that every Indigenous person who wants a vaccine will get one by? Are we thinking of early summer, especially since communities are being prioritized and the Prime Minister has said every Canadian who wants a vaccine will get one by September?
Well, what we know for now is that our objective to get 75% of the northern remote communities fully vaccinated by the end of March is still on track. And that's good news. And indeed, the numbers for the first dose bear out that trend. You asked me about the remainder of the population, and that is one that has a multiplicity of complexities to it and folds and prioritizations. And one of the elements that one of your colleagues highlighted was the prioritization that needs to be made for urban Indigenous populations, as well as populations that weren't necessarily caught within the quote-unquote northern and remote category. That is a rough determination, and is one of those determinations that's made in real time with some consequences on communities that are similarly situated, or communities, for example, in Ontario that may be connected by a road and weren't prioritized and are considered to be left behind. Those are fault lines that, with limited doses, can only get worse. With the doses coming in, we'll continue to advocate for those vulnerabilities to be addressed through massive vaccination campaigns. What we've seen so far is amazing logistics in communities in getting those the information out, getting to elders that may not be able to move. The work that Orange has been doing has been amazing. The armed forces have been exemplary in helping with that, but also some of the people that are doing this in a culturally sensitive way, Indigenous elders leading the way, chiefs. These are all elements that'll play into the first answer about my concerns. What I would have said 3 weeks ago is still that element of trust. There's a very thin level of trust between Indigenous communities and the federal government and the provincial government and territories. It's something that we've had to compose with, particularly as we've seen in the last few weeks with respect to how the healthcare system has dealt with Indigenous peoples. That's an extra hurdle to overcome. But based on some of the numbers that I'm seeing, that we're seeing as a team, that trust, as thin as it may be, is there. And it's a question of ensuring that the communities actually get those doses and that there's no sort of break in the chain and the continued momentum. We can't discount bumps in the road or mistakes. And we saw one in BC with a couple hundred vaccines that were promised. And when people see that promise broken, it doesn't help. And I get that apologies were made, but we don't want those things to have a ripple effect and break that level of trust. I think some of the work that's been done in Manitoba by Chief Dumas and Marcia Anderson and their teams has been amazing in overcoming sort of some of the Facebook doctors that and if it gets hold in a community, just as if it gets hold in downtown Montreal, can create that skepticism. But in the case of Indigenous communities, it is a skepticism that is well merited with the historical past. So it is an additional challenge than simply your run-of-the-mill anti-vaxxer. So I would say a combination of keeping the momentum and building trust, as well as a continued focus by the from the two people by my side on logistics and deployment.
Because of historic colonization, residential schools, and in the past, experimentation on Indigenous people without free, prior, and informed consent. Minister just spoke about trust. Trust, is earned, and it is extremely important. One of the things that all the partners are working together to aim for getting enough vaccines, distribute the vaccines, and discuss about the vaccines and co-plan the vaccine rollout with First Nation, Métis, and Inuit people in order to achieve coverage of all of the Indigenous people, Indigenous adults, before the summer. Thanks.
Christian Ashkate with CTV News. I'm wondering, just touching, you talked about it a bit there, but vaccine hesitancy, people talking about the historical context of that, but what is your message to those people who are saying, I don't trust what's going in my arm? Maybe there's going to be some long-term effects down the road. What do you say to those Indigenous people who have these thoughts in these communities? I see it all the time in the comment sections every time we share a COVID story or vaccinations underway in First Nations. What do you want to say to these people?
Look, it's an excellent question, and my voice is less important than some of the Indigenous health professionals out there leading the way. I mentioned Dr. Marcia Anderson, who's been doing exceptional work in Manitoba. I mentioned that there are an amazing amount of health professionals that are spending a lot of their waking hours getting that information out. I think when you see, and it isn't just people with medical degrees, there are lots of them, and they are getting information out as much as possible, the most accurate set of information from the companies. I think what's been key to this from the very beginning is making sure that people have a choice, and it's an informed choice that comes with all the information possible, and sometimes in languages that we're not used to addressing people in. Rebecca Kudlu from Pauktetit mentioned the importance not only of getting things out in Inuktitut, but in regional dialects and variants, so that people do have that set of information that they can take a choice. People are smart, and they make the smart decision. The Health Canada has an immense amount of experts that have gone through all the information, and it's a process devoid of any political influence. We weren't the first to approve it, but we were very close to one of the first. But Canada's healthcare approval system for vaccines is one of the highest regard in the world. And so when they approve something like Moderna and Pfizer, it is not a decision made rapidly. It doesn't change all the things that Tom and I spoke about briefly and the experiences that you report on. But the key is getting that information out into the community, having health leadership and political leadership be the voice of it, because that's where the trust is, and allowing people to make an informed choice with whether to respect, whether to go out and get that vaccine when they see some of their grandparents doing it. I think that's a good impetus. But it's a constant battle, and you see some variance within communities. But I think overwhelming if we were to generalize, and I hate generalizing in these circumstances, but the uptake has been surprising, and I think it will continue to be. We focused on the elderly and the most vulnerable, but as we see them getting their second doses, and the phase 2 deployment rolling into communities, I think there'll be some continued positive stories. But I think my voice counts much less than the experts, and particularly the Indigenous experts, and that involves partnering with us. And so far, I believe my team's done a great job at that.
Just my follow-up regarding vaccine hesitancy, is it having an impact on the rollout in the northern communities and the First Nations?
Well, so, the data is coming in But we have heard from the Northern Intertribal Health Authority, for example, in Saskatchewan, that the uptake has been strong. Nunatsiavut, the Inuit self-government in Labrador reported very strong uptake numbers with respect to their vaccination campaigns. So we have heard some instances in some communities, but I would say that overwhelming information that is coming is that the uptake has been strong. And if there is a situation where a community does not fully use the doses that they have received, regions have put in place plans so that they can redistribute those vaccines to others who do want to have them in the community.
Thank you. This concludes today's press conference.